We're really privileged to have our Dean and CEO, Dean of UW School of Medicine, CEO of UW Medicine, Dr. Timothy Dellett, who's going to be giving some of the introductory comments honoring Dr. Alfred A. Strauss and some of the background of Dr. Strauss and the history of our lecture. Dr. Dellett.
Thank you very much, Doug. This is always such a wonderful event, and I think especially this year is a real privilege to be here for the 75th Strauss lecture. It's great to see even more of the family here to really celebrate this tremendous milestone and the impact of Dr. Strauss for our community here at UW Medicine. As a little bit of background, in presenting the 75th annual Strauss lecture, the Strauss Friedlander family is carrying on the tradition established so many years ago by Dr. and Mrs. Alfred A. Strauss. Born in Germany in 1881, Dr. Strauss came to Colville, Washington at the age of 10, an undergraduate at the University of Washington in 1904, and an outstanding member of the Alumni Association. He received the singular honor of Alumnus Summa Laude Dignatus in 1951. Dr. Strauss was a football player, as a baseball star as an undergraduate. As an alumnus, he was active in the recruitment and establishment of scholarships for athletes at the University of Washington. He personally recruited more than 75 football players from the Chicago area, 5 of whom went on to become All-Americans. In 1981, he was elected to the Husky Hall of Fame. Dr. Strauss received his medical degree at Rush University Chicago Medical School in 1908, graduating first in his class. He interned for 2 years at Michael Reese Hospital in Chicago and completed a brief surgical fellowship under Professor Enderlin in Heidelberg, Germany. He then returned to Chicago, where he spent his entire medical career. Dr. Strauss possessed a rare combination of skill, vision, and drive, and was intimately involved in many of the firsts in the advancement of medicine, including refinements in pyloroplasty, subtotal gastrectomy for peptic ulcer disease, surgical advances for inflammatory bowel disease, and the first description of an abdominal wall zipper to facilitate frequent re-explorations. Now, Dr. Strauss and his 2 physician brothers, Herman and Siegfried, also University of Washington undergraduate alumni, founded Weiss Memorial Hospital in 1953 in Chicago. Dr. Alfred Strauss is also well remembered for his impact on the founding of our own University of Washington School of Medicine. In July of 1944, Dr. Strauss, as a member of the proposed medical school committee, met with Governor Langley, strongly advocated for state funding of a new medical school. Subsequently, an appropriation bill was signed by the governor on March 15, 1945. And then in the fall of 1946, we welcomed our first class of medical students. True to his continued interest in our institution, Dr. Strauss sponsored a surgical lectureship in 1950 for the Department of Surgery, and these lectures have been a prestigious annual event ever since. Today's program, again, is very, very special, marking the 75th anniversary of this event, and is supported by Alfred A. Strauss Endowed Lectureship in Surgery, established by the estate of Mrs. Marjorie Friedlander, daughter of Dr. Strauss, and annually supported by generous contributions from Dr. Strauss's nephew, Dr. John Strauss, and grandson, Mr. John Friedlander, the son of Marjorie Friedlander. We are incredibly fortunate to have Dr. Strauss, Mr. Friedlander, and their families with us here today. So again, it is my pleasure to honor Dr. Strauss once again at the 75th annual lecture. Doug?
Thank you, Dr. Dellett. And I know that you can't say he's leading our medical school executive committee, otherwise he'd be here, but we know that you took time out and we really appreciate you introducing today's lecture. And I'm just going to make a few comments before I introduce Dr. Turner. because 75th is really a time to celebrate and think about what has gone on over the past 75 years to get us to this point. And if you look in your program, you can see those 74 previous lecturers. And I'm going to highlight a few of them just to give you an idea of the icons in surgery that have lectured here for us, with an upcoming icon going to be also lecturing to us today. So Dr. Dallas Bemister in 1951, so the second year. Dr. Edwin Churchill in 1956. Dr. Michael DeBakey in 1968. Dr. Franny Moore from Brigham and Women's in 1972. Dean Warren in 1974. Dr. Norman Shumway in 1984. Dr. LaSalle Fell in 1997. And Dr. John Wong in 1999. I particularly wanted to highlight some of these from a little bit more distant past, not the most recent people, but just to show you an example from photos of old meetings. This is 1968 with Michael DeBakey and Alfred Strauss. And I think it's really nice to see a photo of the three surgeon brothers, Herman, Alfred, and Siegfried. And when I was just recently at the University of Chicago and Weiss Memorial Hospital, Dr. Strauss showed me their portrait in the lobby at Weiss Memorial Hospital. Really a remarkable group of surgeons that founded the Strauss Surgical Group, a large multi-practice specialty group in Chicago. And I have a handful of photos from old meetings. We get to see Dr. Pellegrini just a year after he started off his chair here with Dr. Skinner as the visiting professor. And you can see also a younger Dr. John Strauss in this one, and Dr. Schilling. And a couple of the brochures. So this is Dr. LaSalle Lafal in 1997. I put this one up since Dr. Andrew Warshaw was one of the surgeons that I trained with and a mentor for me, and who was here in 2002. And Richard Finley, so someone from close to us in Vancouver, British Columbia, talking about the myths and realities of the Canadian healthcare system, something I discuss with my wife, a Canadian physician, not infrequently. But I'll end with this one because this was the 50th anniversary of the Strauss lecture. Dr. John Wong, a very good friend of both Dr. Pellegrini and myself, was our visiting professor for the 50th Alfred A. Strauss lecture in 1999. And many of you that have been in my office know that we proudly have this portrait of Dr. Alfred Strauss in our office. So with that background, I'd like to introduce Dr. Patricia Turner. I think for many of you know, she does not need a major introduction because you know of her as the Executive Director and Chief Executive Officer of the American College of Surgeons, and also a clinical professor in the Department of Surgery at the University of Chicago. But to give you a little bit of Dr. Turner's background, Dr. Turner did her undergraduate training at the University of Pennsylvania, medical school at Wake Forest, and then did her general surgery residency at Howard before doing a fellowship at Mount Sinai, Weill Cornell, and Columbia combined program. And she was then recruited to the University of Maryland, where she started off as a junior faculty member doing minimally invasive and laparoscopic GI surgery. But she started off as associate program director and then became the program director of the general surgery program at the University of Maryland and the medical director of surgical acute care. In 2011, she was recruited to be the division director of member services for the American College of Surgeons. And then she developed clinical appointments in Chicago at Northwestern and University of Chicago. And many of us worked with Dr. Turner during her tenure, and tenure is almost exact tenure as the division director for member services. And when Dr. David Hoyt stepped down as the executive director of the American College of Surgeons, Dr. Turner was chosen to be the new executive director and CEO of the ACS. So there are many things that Dr. Turner is known for in her history. She's received multiple awards and distinguished lectures. Hopefully this will be included in that now. She's received awards for both her accomplishments, her mentorship, and her leadership. The Olga Jonassen Award from the Association of Women Surgeons, the Concerns of Women's Service Award from the National Medical Association, the Nina Starr-Braunwald Award from the Association for Women Surgeons, and the 2024 Society of University Surgeons Trailblazer Award. She's been involved in multiple professional organizations and in advocacy boards beyond the ACS, and she's president-elect of the Council of Medical Specialty Societies. Most importantly, Dr. Turner is a generous mentor. She's an inspiring leader. She's a strategic thinker, and she's a kind and loyal friend. So we're really pleased to have Dr. Turner here as our 75th annual Strauss visiting lecturer. Dr. Turner.
Thank you, Dr. Wood, for that very gracious and kind introduction. It is really a pleasure to be here. Thank you to the Strauss and Friedlander family for your generous support of this extraordinary lectureship, and it's really just an honor to even be on the list with these iconic names in surgery that have previously given this lecture. So it's an extraordinary pleasure to be here. Thanks to all of you who came out last night. We had a marvelous dinner, and I appreciate the sincere, warm welcome back to Seattle. I've had the privilege of coming to visit with Dr. Pellegrini and Dr. Wood and others of you in the past, and so it's a joy to be here, and thank you again, sincerely. So, as one does when talking to a room full of medical leaders about leadership, my hope is that there's something here for everyone, that we're going to leave this conversation, and that those of us, the most junior of us to the most senior of us, will have something here that we can think about and talk about. So I have no disclosures. And have to start, I won't recapitulate what you've already heard, but have to say that it was really a privilege for me to learn about Dr. Strauss as I was preparing for this event. As you've heard, an extraordinary surgeon, a leader, a researcher, an educator, an athlete, an entrepreneur. And so it was really a pleasure to learn about him, and again, to have met his family, his nephew, his grandson, and to think about how it is that he created an environment where he went into practice with his brothers. He moved the envelope on evidence-based patient care. He created an environment in which patients got great care, and then came here and was particularly meaningful in the establishment of the School of Medicine. So really an extraordinary leader, and a privilege to give this lecture in his honor. So thinking about leadership, you always like to start with definitions, and this talk is no different. So there's as many different ways to define leadership as there are those people who've determined that they want to define it. So that's, not too hard to understand. I like these other two that I'm going to start with. Leadership is the behavior of an individual directing activities of a group toward a shared goal. And I think that notion of a shared goal and of the team working together and what is it that's in the greater good in that context is important. I like this next one about making others better as a result of your presence and making sure that impact lasts in your absence. So again, when thinking about Dr. Strauss, I think it's clear that these are definitions that apply to him as an individual, and that as we all seek to be more effective leaders, we can incorporate some of this into our thinking. But what is not necessarily leadership. So leadership is some of these things, but it's not only a position or title. So there's many ways to think about leadership skills that can be exhibited from whatever position we're in. So even the most junior among us can be effective leaders. It's not only having the most knowledge or technical skills. Certainly as surgeons, we think that that is a requirement. Clinical acumen is necessary. It is essential, but not sufficient. And in fact, perfecting our knowledge and knowing the most about our patients is the floor, not the ceiling. That's essential. And then we build our leadership skills on top of that. It's not only being an entrepreneur. So certainly those who are leaders can be business savvy. They can be entrepreneurs, but it's not about business or focusing on business or financials per se. And finally, it's not really only being a pioneer or being the first to do something. So certainly leaders can be the first, they can be the innovators, but that's not the only way to be an effective leader. So I'm going to talk this morning or this afternoon about agile leadership, and I'm going to set up for you what may seem like diametrically opposed ideas. And hopefully by the end, I'm going to convince you that you need to be both of these things that may seem like two opposite sides of a coin. And that in order to be an effective leader, we have to do both of these things that may feel like they are in opposition. So what do I mean when I talk about agility and leadership? So certainly it's the ability of leaders to navigate uncertainty, complexity, to adapt quickly, to be nimble, to change when the data facing us change. And they have to drive innovation while also maintaining a clear strategic direction. And the bigger the organization for which you're responsible, the more challenging that can be, because it's hard to move these big ships. Someone earlier today had the Titanic, on their slide. And so thinking about how to turn a big ship can really be a challenge. But being able to shift in the right way at the right time when faced with new data, being able to appropriately allow that your decision might change is important. And it's important for organizational success, no matter how large or small your team. And in fact, in the world in which we live, full of turbulence, full of change that comes at us really quickly, that's the marker of an effective leader. So turbulence, pick your topic. We can think of, just go back in the last 5 years, we can all come up with a laundry list of turbulent things that have occurred in our society. And whether you are thinking about internal or external turbulence, you want to talk about external things, force majeure, natural disasters, acts of terror, war, geopolitical issues. We have all of these things going on, right now, financial issues, social issues. Changes in institutional leadership. So these turbulent occurrences are not only external, but they can be inside the very walls of our storied institutions. And it's our job as leaders to figure out how to navigate that for and with our teams. And even shifts in leadership, even changes at the division level can create stress and angst. And then how do we respond and react to that? So what I will suggest to you is that agility in leadership requires that we do all of these things and that functionally we do them concurrently. That we manage and lead, that we're confident and humble, we teach and learn, we're stubborn and we have an open mind, we're laser focused and have situational awareness, we're visible and invisible. We attend to both the individual and the collective. We encourage harmony, but we also embrace conflict. We model high standards while we are graciously forgiving. We add and subtract, and we're both timely and timeless. And I do recognize that's a laundry list, and we're going to move through it quickly, but my hope is that by the time we finish this, you'll embrace the fact that we do have to be all of these things, and we can do that effectively. So when you think about managing and leading, I mean, those of us who may be reading the Harvard Business Review or got an MBA or took a class or whatever, maybe at the beginning of the class, we thought those were kind of the same thing. And so they really are quite different. And my belief is that we have to be effective at both managing and leading our teams if we're going to be functionally extraordinary or good or better leaders. And so management is really about focusing on tasks or things. It's getting things done. It's minimizing the complexity, it's putting up the guardrails, implementing plans, having authority over people, being able to direct them to do what you need done. And it's about systems, setting up and maintaining systems. And that's critically important, particularly in times of crisis where things might be going awry. But leadership is more about the long arc. Leadership is about managing your people, getting the best out of your people, creating a vision that produces change, getting people who don't see what you see to follow you, because they believe in your vision and you can articulate that to them. And it's helping people adapt and getting the most out of them so that they're prepared for the situation and really aligning the people, putting the right people in the right seats on the bus and getting them to align with you and with your vision. And so when you talk about, who writes about this, Stephen Covey, we've all heard of him. Management is efficiency in climbing the ladder of success, where leadership determines whether the ladder's leaning against the right wall. I think that's really metaphorically very clear. Peter Drucker says management is doing things right, where leadership is doing the right things. So we need both of those to be effective. And I like this kind of 2x2 table. Lots of things work nicely in a 2x2 table. But if you're thinking about leadership and management, if you're a poor manager and a poor leader, everything's doomed to failure, and it's a pretty short conversation. If you are a great manager, but a poor leader, well run, but bureaucratic and unable to pivot, unable to move. In the bottom right corner, there are poor management, but great leadership, innovative, adaptive, but chaotic and probably not sustainable. Where in the top right corner, which is where we all endeavor to be, great management and great leadership is well-run and innovative, adaptive, energetic, and all of the things. So, we want to embrace both sides of that coin. Next, confidence and humility. So confidence, it motivates our team to act. If we don't have confidence in ourselves, if we don't have the ability to believe that we can do what we're suggesting that we can do, then no one else is going to believe us. So there's that certain, introspection that we have to have. And it makes our decisive decisions appear reasonable. We're confident, we exude that confidence, and people are like, okay, I can see that. It creates a sense of security amongst the team, and it makes your energy contagious because people are like, okay, I get that. I want to follow that person. They're confident. But we also have to have some humility, because otherwise our team does not feel empowered to give their suggestions. You're the only one with all the answers. They may have an answer. They're afraid to tell you. You don't create an environment that allows that open conversation, because if you're not humble enough to say that you might have the right answer and mine might not be so correct, then your team doesn't trust you. And so you have to be able to communicate that humility and that trustworthiness in order to accept input from wherever it might come. It fosters the authenticity in others. And in fact, it makes your confidence believable, because this notion that you are an all or nothing effective leader, it's just not believable. So confident but humble is really the middle road that we're going for, and allowing that we should do both. One individual, no matter how well read, typically does not know everything, particularly not in times of crisis, particularly not in complex problems. So if you are trying to create the right answer to a complex problem, you have to be willing to accept input from unconventional places, which is to say, don't surround yourself with sycophants who all think exactly like you, because you're not going to get to the best answer for the complex problem. And sometimes we have to allow that there is no single good or right answer, or that the answer might be nuanced. Or more difficult for many of us is that it's not a failure of leadership to accept that our position might morph over time. In the clinical environment, we understand that. If the patient presents like this and then you get in the OR and it looks like that, then we pivot and we do something different. But in leadership, we often feel like we have to be so set in our ways that we're unable to accept that our response or our answers or our decisions might change. So it's important for us to keep that in mind. So teaching and learning, again, I think we can think about pretty naturally how those work together, but teaching, clearly we're imparting critical information. We know something, we want our team to know it, we want our folks that are more junior to us to understand it, so we teach. And that empowers people to think on their own, because we've conveyed our information to them, and it permits our colleagues to grow. But we also have to, correct our errors. We have to learn. We have to have a continuous growth mindset, a learning mindset. We have to be able to say we can also learn. We may be senior, we may be the chair, we may be the president, we may be the whatever, but we too can continue on our leadership journey. We too can continue on our clinical journey. So this notion of creating an environment in which you are a lifelong learner and you encourage that in your team is part of, again, both sides of that coin. So it goes back to the humility, the growth mindset, the acknowledgement that we don't, in fact, know everything. And we are all on this journey. No matter where we are along the continuum, we're all on a journey, and allows us to be more effective as we move forward. So I like these two quotes, Nelson Mandela: education is the most powerful weapon that you can use to change the world. I think that speaks for itself. And then I, really love this Einstein quote, which we've all heard: if you can't explain it simply, you don't understand it well enough. So, we all know those people that like to talk at the 30,000-foot level, and it's like gobbledygook and nobody knows what they're talking about, and they lean into that. And in fact, they like to make it more complicated than it really has to be, so they can feel really smart. The reality is that if you're really effective and you really know your stuff, then you can make it clear to someone who knows nothing about what you're talking about. And so not thinking of that as a way to demonstrate how smart you are, but thinking of it more like if I can understand it well, then I can explain it to you, leans into this growth mindset. So being stubborn and being open-minded, I mean, that may or may not make a lot of sense to some of you, but I think there are really reasons for us to be stubborn. You know, tenacity is a key. You know, we are sometimes wrong, but never in doubt, right? I mean, that's what's said about us all the time. And so tenacity is critically important. It prevents us abandoning a goal too early. We talked about it taking, 14 years to get the evidence base into clinical practice. We talked about, submitting 5 or 6 grants before one is funded. So there is definitely this notion of tenacity being essential. So we don't abandon our goals too early. So we aren't, so unwilling to invest the effort that we give up too soon. And it helps us tackle really tough obstacles. But we also have to be willing to accept that, there are some shifts that have to come into play. And if we do it the same way every time over and over, we're not going to get a new answer. And so we've got to be willing to be open-minded. It also models for those who are looking at us the ability to say that they too can change, and that doesn't make them an ineffective leader. Because as leaders, someone is looking at you, whether you're a senior person, a junior person, there's some medical students in here, there's some undergrad students that are looking at you, medical students, and thinking that you have all the answers. The interns, those medical students would give their right arm to be where you are. So wherever you are along this leadership continuum, someone is looking at you and trying to model themselves after you. So that's incredibly important for us to think about. And sometimes what helps us do that is centering the mission. So over us as individuals or over us as one part of a team is this notion about being open-minded enough to incorporate the core issues of mission of your institution or of your professional society or what have you, that allows you to make the right decisions. So both sides, counterintuitively, I think, represent stability. So if we think about stubbornness, that is stability in values and practice. If we think about open-mindedness, that's actually emotional stability. That's what allows us to engage effectively with our team. That's what allows us to get the most out of our team. So while it may be counterintuitive, I think that both stubbornness and open-mindedness facilitate our ability to be stable. Both sides also represent change, because if you're open-minded, obviously it goes without saying that you can see the upsides to a proposed change, but the stubbornness allows you to change without losing sight of the key values and centering the mission. So I like this quote, which has been variously ascribed to Thomas Jefferson and others, and I'm not sure, who really said it, but in matters of style, swim with the current, in matters of principle, stand like a rock. So identify the things where you do need to dig your heels in, identify the places and areas where it is important to be stubborn, and then let some of those other things flex. And that is what will help us get to the right answer. So again, 2 sides of the same coin. So having focus and having situational awareness, again, seem like opposite things, but we need both. So the notion of focus, clearly you've got to chart a course from point A to point B. So you've got to have a goal, you've got to identify the goal, you have to be able to articulate that goal and tell your team how you're going to get there. And that allows us to get through things in a timely fashion. You're not meandering all over, you're not paralyzed, analysis paralysis. I think we all know those people. And it prevents the over-focus on obstacles because we are focused on where we need to be. But you can't ever lose sight of the greater good, the greater picture, how it is that this fits into a larger context. And that enlarges our options. It allows us to be innovative because it allows us to think more broadly than we might if we remain laser focused and too narrowly focused. And it helps us prioritize, because if there's 10 things we have to do between point A and point B, what is the order in which we should tackle them? And that can only be done in the context of the greater conversation. And in fact, in the most complex things where other stakeholders have to be brought along, you can't just be laser focused and not talk to anybody else, because then it's not effective and you can't really move forward, because most of the complex decisions we have to make are not really ours alone. They involve other stakeholders that we have to bring along to our way of thinking. And I like this video, so I'm going to show it. It has the sound, but let me see if I can get this going. Okay, so these are the Blue Angels in Chicago at the Air and Water Show. I think we all love the Blue Angels, but this is a view I want us to spend a second looking at. So this is from within the cockpit. Do you see how close these planes are to each other? I'm just gonna stop talking so you can watch the video. I mean, like you could reach out and touch the plane. And they're hurtling through the skies, at this point. Anyway, so my point in saying that is laser focus, absolutely. Situational awareness, absolutely. Either one of those, and everybody's gone down, in flames, metaphorically and literally. So, I mean, that's a great example, I think, of how it is that we have to be able to do both of those things if we're going to be effective. So visibility and invisibility, again, seem like polar opposites. I think being visible is, where leaders inspire by example. They are out in front, they are visible, they are leading, it's obvious, and they're modeling the correct approach, and people are patterning themselves after. And it also allows your team to become confident in your leadership. But there are also people who take a more servant leader approach. They lead from behind. And there's nothing, inherently right or wrong about either of those approaches. And what I'll, sort of not going to bury the lead here, but at the end, I'm going to suggest that we need to all have all of these arrows in our quiver, and that we need to make sure to allow our team, for example, to gain experience. And the only way that we can do that is by letting them take the lead and by taking a step back and allowing others to make decisions, or by delegating. And it enables these kinds of conversations. But I'm going to use this example about, where invisible leadership can really get you in trouble. So this guy is called Wagner Dodge. So these hills that you see in the background are from Man Gulch, which is an area in Montana, and the Helena National Forest. So this guy was a smoke jumper. And, at the time when there were fires, people would fly in, they would jump out of the plane or jump out of, and they would be dropped into an area near the fire, and they would fight the fire. And that's kind of how this was done. The story I'm about to tell you happened in 1949. So you can see here that, well, you probably might not be able to see it, but here's the Man Gulch. So this is what we looked at on the previous slide. And so the smoke jumpers were dropped in, and they were rapidly overwhelmed by the flames. They were dropped a little too close. The flames were moving too quickly. And this guy, Wagner Dodge, who was the most senior person on the team, had a habit of being really, really very quiet, kind of servant leader in the back, didn't make a big deal of being an effective leader. And so when they were in a situation where they were being overrun, some folks tried to run, some folks, panicked. And he came up on the fly with this idea that if they were to burn an area here, and burn away all of the fuel, that they could basically hide in this burnt out area, and the flames would pass over them because they would be in an area that didn't have anything that could burn. Radical idea. It's now standard firefighting tactic, but at the time, no one had ever heard of it. His team, because they were like, yeah, well, you're not really the leader that we trust. It should do something radical like this. And, half of his team ran, and they all died, hence the cross here. The handful of people who were like, you know what, I'm going to just trust and believe and go with this guy and his strategy, they hunkered down in the burnt out area and they lived. So the point about this is that, being visible isn't something you can just do in a crisis. So if you're trying to decide about whether you want to be a servant leader or you want to be that leader that's out in front, I mean, all of that is fine. Pick the strategy that works for you, do both, we understand it, but you can't wait until the crisis when literally the chips are down to decide you want to be a different kind of leader. Our job is to model both of those in appropriate times, because you can't wait till the crisis to become that visible, sort of inspirational leader. And leading in a crisis is made possible by being visible in calmer times and allowing your team to trust, allowing your team to see you in that capacity so that you don't wait until, the wheels have fallen off the wagon. So giving individualized and collective attention. So clearly we've got to focus on the individual. We've got to do one-on-one coaching. We have to do mentoring. We have to take people under our wings, recognizing each person's individual talents and skills and putting the right people in the right seats on the bus. That's the coaching. That's the developing individuals that we think about when we think about leading. But we also have to attend to the collective. And it's kind of like what we talked about before, being focused and also having situational awareness, because all of that has to happen in the context of the institution, department, division, organization. And what is the end goal? What is the greater goal? Because what may be right for one individual or two individuals may still not be the right thing for you to do overall. And so it sort of becomes, in some ways, kind of an ethical conversation. Are you doing the greatest good for the most? Are you doing what's right? You know, what you've been charged to do as a leader, and how do you then adapt so that you are supportive of individuals in the context of what's important to the collective? And so this is that synergy where the whole is greater than the sum of the parts. And so it's your job as a leader to figure out how to get the most out of your team, to cobble together what is functionally a mosaic so that your department, division, institution, whatever, creates one whole organism. And everyone's not going to do the same thing. Everyone's not going to have the same skill set, but it's our job as leaders to cobble that together in a way that's incredibly synergistic. So this is just a schematic that talks about kind of bringing everyone together. So harmony and conflict, you know, I like this one because some of us love harmony and they want everybody to get along and they want never a crossword and everyone's always like kumbaya, you know, and the reality is that that's not necessarily the way to solve problems. Now, others of us just love conflict and they love to throw the bomb into the middle of the conversation where everything is going fine just because they like to be centered in the middle of angst and, you know, drama. So neither one of those is ideal. And you do want harmony. You want smooth operations. You want to, you know, maintain the status quo in a way that allows us to get along effectively. You want the team to focus on what's important and not bicker amongst themselves. And that's great. But you also need to be able to hear from disparate viewpoints. You also don't want to surround yourself with people who have exactly the same lived experiences, exactly the same problem-solving skills, exactly the same heuristics, exactly the same language. And that doesn't allow you to think new thoughts. That doesn't allow you to have innovation. And that doesn't allow your team to bond, be able to have critical conversations and still get along and, you know, break bread together or have a glass of wine or, you know, play whatever softball or whatever you might do as a team to get yourself back together, which allows you to have these critical conversations and not have it rend the very fabric of the team that you're building. And that occurs naturally if you work on it. So I like this graph, performance on the y-axis, tension on the x. So on the left, there is false harmony. If you can't see what the word said, false harmony, that's no tension and poor performance. In the center there at the top is, you know, constructive conflict. So some tension, great performance. And then at the right side of the graph is, you know, polarization, which is you're back down on the negative part, too much tension, poor performance. And so our goal is to center our teams there in the middle between false harmony and untoward conflict. So how do you prevent and diffuse unhealthy conflict? Because again, maybe I'm the only one who's ever met any of those people who like to bring drama to the conversation, but what do you do about that if you have that person on your team or in the room or you're having to negotiate with them? So trying to understand the deeper concerns, acknowledging, you know, anger, fear, frustration, whatever is underneath it, because sometimes people are just dreadful, but they're dreadful for a reason. And if you can uncover that deep dive, if you can go down to the root cause analysis, you can figure out what's undergirding it and you can solve the problem and then everything else takes care of itself. Reduce the binary. Sometimes what we do, particularly at times of stress, is you try to sort of oversimplify things and you try to make it like black, white, yes, no, up, down, you know, and often, again, in complex scenarios, which is what we're really talking about here, it's rarely that simple. And so reducing the need to try to make everything a binary, you know, you win, I lose kind of conversation helps us get to a point of win-win. Articulate both sides. What are your concerns? What are my concerns? What's the third party's concerns? You know, and how do we get to yes? Marginalize the troublemakers. This is really important. Those people who want to throw a bomb and like upset the apple cart, you know, you've got to figure out how to manage those people. I could give an entire talk on managing difficult people, as I'm sure many of you in the room could. And the way that we work with those individuals in a way that doesn't, that is true to our own sort of inner, you know, core of the way that we interact with people, you know, respectful and professional, but also not allowing them to, you know, rend the fabric of your meeting or whatever. You know, that's an important way to think about it. But you've got to empower people that are more curious and open-minded with a growth mindset than self-righteous. And those individuals who just want to like sort of bang on the desk and be right about everything. So you've got to figure out how to neutralize those people. Otherwise, it'll take the wind out of the sails of the really thoughtful folks. It may just be more quiet. And you've got to invite them into the conversation. So avoid bonding via mutual disdain. Again, that can happen, right? You end up getting with somebody and you're both complaining about the same person. And you end up with this sort of, you know, trauma bonding. Don't do that. You know, it's easy to fall into that trap, but it's not productive. Buy time and make space. So creating the environment where you can say, like, I feel the heat in the room, I feel the conflict arising, let's take a break. Let's, talk about this later. Let's put this on the agenda for the next meeting. Let's put it in the parking lot. I mean, there's all sort of consultant speak that we can use. But at the end of the day, what you're trying to do is introduce space between trigger and response. And however you introduce that space that feels authentic to you is a way to get out of that unhealthy conflict that can then sort of take on a life of its own. And now you've got people that can't functionally work together. And now as a leader, you've got to figure out how to unravel all of that. Where if you could create some space for them, even if they don't know that they need the space, that might help you get to a better place. And then finally, complicating the narrative is similar to, reducing the binary. What are the nuances? What are the issues? It's not always just yes, no. Where are people feeling torn? Sometimes they're trying to make a decision and there's no good answer. I mean, many of us know the scenarios where there's 3 bad answers and you're trying to pick the least bad of the 3 answers. So, how do we create that environment? So modeling high standards and graciously forgiving. So thinking about modeling high standards, that's important. We're surgeons, we do this all the time. Rigor, evidence, like that's what we do. And we hold people accountable. And that is the coin of the realm. And so we give people a yardstick. We say, live up to my expectations. You don't fall short. I'm going to give you feedback and I'm going to help you get to where I'm setting the bar. And that is fair. And it lets people know what we expect of them. And that's part of what's an effective leader. You're communicating that expectation to your team. On the other hand, you've got to be able to graciously forgive. That's not to say that when people do something dreadful, they shouldn't be held accountable, but we are all human. And we have to be able to create an environment where you are not perceived as so punitive and so unreasonable that people start lying to you and hiding their errors, because that is the problem. And that's a situation that you can't unravel because now everybody's lying to you and telling you everything is fine. And in fact, it's not fine. So we've got to create an environment where we are both holding our team and ourselves accountable, because the best way to hold your team accountable is to hold yourself to that same high standard, but to also acknowledge that we are human, that errors are inevitable. What is the root cause? Is there a system that we can put in place to minimize that error occurring again? The error has happened, but it shouldn't happen a second time. How do we maintain calm and not create undue consternation that leads us to a situation where we can't get out of it and it becomes kind of a self-fulfilling prophecy? So thinking about focusing on the future, how to put guardrails in place, how to make better decisions next time, as opposed to re-adjudicating and fixating and focusing on the past, allows us to live on both sides of that coin. And so using a growth mindset, we kind of talked about this, the fixed mindset is, I want to be perfect. I want to be smart. I want to look good. And what we want is the desire to learn and grow. Those of us with children know, if you read the books about how to raise your kids, they tell you not to praise your child for bringing home the A, but praise your child for making the effort to do the hard work. Because if you praise them for the A, they want to bring you A's because they want to please you. So they're not going to try hard things because God forbid they try something hard, they don't do well, they don't get an A, and then you're not happy with them, as opposed to praising them for the effort, praising them for trying something new. So this is kind of a similar thing. We want growth mindset. We don't want fixed mindset. So you don't want to avoid the challenges, give up easily, not try anything that might be hard or difficult or different. And where you're jealous of other people for their successes. Our growth mindset, which is what we're trying to create, is an environment where you embrace the challenges, you tackle the setbacks, you come up with a better strategy, you're happy for other people's success. You're like, okay, what can I do that's like them? What can they learn from me? And it creates this sort of inspiration in other people's success rather than competition. So adding and subtracting, and we're down to the last couple of pairs here. Adding, obviously that makes sense. We need to add new things. We need to be innovative. We need to create new opportunities, but we also need to learn how to subtract. Some of us struggle sunsetting things. Some of us struggle letting go of something that was amazing before, but like the tide has shifted and we're clinging to this thing that we developed, we established, we planned, we were the first to do. Maybe it's worth salvaging, or maybe it's time to sunset it and go in a different direction. And so it is really difficult to figure out strategically how you decide when to add and when to subtract, but we have to be able to do both. And so we want to yield positive responses and we want to add and create, amazing new things, but none of us have unlimited resources. We don't have unlimited time. We don't have unlimited money. We don't have unlimited FTEs. We don't have unlimited whatever. And so if you continue to add amazing things and you never sunset anything, then what you're going to do is be like, a mile wide and an inch deep, and you won't necessarily be getting the best out of your team or out of the resources that you do spend. So we have to learn to methodically evaluate what we're doing and decide what needs to be sunsetted or what we need to subtract, even as we think about what we need to add. So subtraction in healthcare, it's a New England Journal of Medicine, getting rid of stupid stuff. I mean, I wouldn't have said it quite like that, but the authors did. So this really talked about deletions and how there were recommendations that came from the team, a bunch of recommendations, but some of those recommendations were about things that they should stop doing. So the point, and I won't belabor it, is continue to think about things that are additions, but also think about where we should subtract. And so thinking about effort versus impact can help us make these decisions. So again, I love 2x2 tables, as you can tell. So things, impact on the left there, effort across the top. So in the bottom left corner, high effort, low impact, subtract it, right? It's costing you a lot. It's hard to do, and it's not having a big ROI, not having a big impact, subtract that. High effort and high impact, continue that, seek ways to add impact and subtract effort, try to do it better, try to do it more efficiently, try to expand and increase your ROI. In the lower right-hand corner, low effort, low impact, yeah, continue it, because it's low effort and it does have some impact. It's positive, it's a non-zero amount of ROI. And then subtract it if it becomes more expensive or more difficult to do. And then in the upper right-hand corner, things that are low effort and high impact, add more of those. Figure out how to do more of that, figure out how to add more of those things that allow you to use your resources effectively while having a significant and outsized impact. So how to subtract well, I won't read you all of this, but I'll highlight one. Reassure those who are unsettled by subtraction, because there are going to be a lot of people who struggle because they are personally invested. You've got to make it not personal. There has to be a process. There has to be infrastructure. There has to be a set of metrics that everyone can agree on, because otherwise there's a personal investment that makes it really difficult to let go of things. So thinking about how to reassure those who are unsettled by subtractions. Asking others to be engaged. This is where, having multiple stakeholders involved. So it doesn't look like an individual with a vendetta. It's more, there's been a process. There have been other eyeballs on this decision-making process. What does that look like? Consider where you might be able to, have greater impact, and, changing something, tweaking it might portend a better outcome. And then finally, being timely and being timeless. Timeliness requires us to react to present demands. There are things, there's a new thing coming across your desk every day, and there's a new phone call, new email, new whatever, that's a challenge to which we have to respond. And that requires us to respond to those things in a timely fashion. It's going to make an impact. It's going to make an impact today, tomorrow, this hour, last hour, if you don't respond right away. And that's important for us to do. But timelessness is what sustains us. Timelessness, making those decisions that require us to look around the corner, to look along the long arc of our decision-making process, steadies the ship. It maintains our integrity, the institutional memory. It allows us to make decisions that will live far beyond any of us when we're out of our roles and the next person is in the role or the person after that. And it reminds us of the longevity and, again, centering the mission of what we're supposed to be doing. Everything is not going to be decided, today. Some things are, and we have to be timely, but some things are a longer arc. And we have to continue to try to remind ourselves that investing time and energy on the timeless stuff is arguably more important, or certainly just as important as allowing ourselves to get caught up in the churn of the immediate and the now. So timelessness at the ACS, I can't close a talk without talking a little bit about the ACS. So, Franklin Martin there on the left, Ernest Codman there on the right. So thinking about quality and thinking about what, led the founders of the ACS to talk about having an organization was this notion of enhancing quality. So I won't spend any time on this slide. All of you know I could talk about ACS quality programs for an hour, but from 1913 until the present day, we have been deeply invested in enhancing quality for the surgical patient. What do we do in the hospitals? What do we do with our surgeon members? What do we do to make sure that all patients have access to the best, highest quality, evidence-based surgical care that we can provide? And whether it's cancer, trauma, breast, bariatric, vascular, old people, young people, you name it, we want to improve the care of those patients in whatever their setting is. And so that has not changed. Like, that is timelessness. So whatever it is, it was a timely thing that Franklin Martin was deciding in 1913. Like, I don't know what that was, but I do know that their focus, Codman and Martin and others, that their focus on surgical quality has transcended the last 111 years. So I like this quote: if we want everything to remain as it is, it will be necessary for everything to change. Again, probably sounds like it's, contradictory. But if we want our values, our principles, our goals to remain relevant, then we have to change methods, infrastructure, tactics in order to make those things stick. We can't be so set in our ways that we're unwilling to consider a new approach. We can't be so set in our ways that we lose sight of the bigger picture, of the greater good, and that we have to center the right things and not get so fixated that we're unable to see beyond, our very narrow lens. So some overarching themes: leadership attributes or surgical attributes. I'm talking to a room full of surgeons about leadership. All of you are leaders. Any one of you could have stood up here and given this talk. But when we think about the things that are core to our being as surgeons, it's really all of this stuff. We are required to be on both sides of these equations all the time. And we make a decision based on the environment in which we find ourselves, which way we go at that moment. So we need all of these arrows in our quiver. And so the complexity principle, individuals with diverse dimensions forming their identity navigate complexities more effectively and resiliently. This is all over the business literature. I mean, Harvard Business Review, you name it, in the business literature, all over the place. Complex problems, you need multiple inputs to make the right decisions to thorny problems. And so embracing that complexity can counterintuitively make things more simple. So agility requires making mistakes, and that is hard for us to acknowledge. And clearly, I'm not talking about patient care. I'm not talking about patient errors. I'm talking about along our leadership journey, we have to be willing to acknowledge that we don't necessarily and always know everything ourselves. And we have to be willing to acknowledge that. We have to be willing to accept input from unconventional places. We have to be willing to pivot when we're faced with new data. We have to be willing to acknowledge that sometimes there isn't like just a simple, black, white, yes, no answer. And so skillful leaders recognize failure early and pivot early. The worst leaders are so invested in their rightness that they can't pivot. And they just drive their teams to, the worst possible outcome because they're unwilling to acknowledge that there might be an opportunity to make a better choice. And they're so invested in their rightness that they can't make other options, can't accept other options. And I'll close with empathy. I think in order to be an effective leader, we have to go back to my initial slide where leadership is about the team. If we're going to be effective, we have to have empathy for our team members. Like, you may be the one in the corner office, you may be the one sitting at the top of the org chart, but if you don't have an appreciation or an empathy for what your team is going through, then you're probably not making the right decisions for your team. And that's not going to get you to the right place at the end of the day. So empathy is really the core of effective leadership, because leadership is about the team. Leadership is not about any individual, it's about the team. So final thought, leadership is about making your team better, assuring that what you do and have done lasts in your absence. So if your leadership isn't all about you, it will live beyond you. So essentially, we are called upon to be selfless and empathetic leaders so that our leadership journey is effective over the long arc after we're long gone from our seats. So with that, thank you so much for the privilege of the podium, and I'd be pleased to answer questions.
Thank you very much, Dr. Turner. Let me see if there's any questions from anyone in the audience. I'll start with one. You'll be surprised to know. So as you talked about, obviously surgeons by definition are leaders in terms of what we do every day in the operating room. But we're also talking about a different aspect of leadership, the beyond just the everyday leadership, but aspiring to growing leadership. Do you have any advice for the residents, fellows, and junior faculty on kind of the type of experiences or training that would help them build some of the skills that you're talking about?
Thank you for the question. I do think that trying to find our lessons in leadership, however we find them and taking them seriously, is really a helpful way to think about it. So for example, you may be the mid-level resident, but you might be responsible for taking a group of medical students through something in the skills lab. I mean, that is, leadership. Like, you're educating them, you're teaching them, you're figuring out what's the most effective way to convey that knowledge. If you're the chief resident and it's your job to make your team look like it's functioning smoothly while you're talking to the attendings, I mean, that is managing up, down, and sideways. Like, I mean, I do that. I imagine pretty much everyone in the room can think of a situation in which they have to manage up, down, and sideways. I mean, everybody has a boss. Everybody has a boss. So the ability to effectively communicate with those above you, those below you, and those beside you, I mean, that is a core leadership skill. Thinking about, if you've got to put together, a multidisciplinary research effort, and it requires you to talk to the medicine people, and it requires you to talk to the nurses, and it requires you to talk to the patient transport folks, and it requires you to, I mean, that is a multidisciplinary team. So your ability to convey your hypothesis and explain it in a way that everyone can understand, have them all get on board, have them enroll patients in your clinical trial that you're thinking about. I mean, that is teamwork, leadership, communicating, a complex topic to multiple people. So, I mean, I think all of those opportunities come at us all the time, and we don't think about them as leadership. It's not like I went and sat at Harvard and got an MBA, but those are all leadership skills that we can build on and, put all those arrows in our quiver. Dr. Waffles.
Thanks for a great lecture, Dr. Turner. Of the 11 pairings that you have, I think there were 11, which is the one that you think will be most challenging for citizens to take up? And what are some ways, building on Doug's question, where we can practice or simulate or advance our skills?
It's hard. I think they all resonate with me at different times, and I think it depends on which is the conference room I just walked out of, which one I think is the most important. I think the one about being sort of visible and invisible is one that is probably a challenge because, as you said, Dr. Wood, we are leaders by very definition. We're leaders in the OR, we're leaders, on the floor, we're leaders with our patients. And so it's tough to think of a situation in which we can let go of control enough to let somebody else lead. And that's a learned skill. I know that I struggle sometimes with, the attitude that like, I might as well just do it myself. Like, I know it'll get done the way I want it done if I just do it myself. Like, you can't do everything yourself because then you're ineffective. So you've got to figure out how to let go of things. So I think that the natural tension between being visible and invisible as a leader is probably the one that is most difficult for us because we are so naturally leaders in every setting.
Dr. Mayer.
That was a superb lecture. It really was. We'll be begging you for a copy someday soon. But in regards to the balances, and as you say, it's hard to pick the one, but one that you mentioned is you can't continue growing forever, even if you have great ideas. And you have to make the very hard decisions as to when do you stop adding and even subtract. And yet when we show, like in your last slide, there was, I don't know how you demonstrated the negatives that you subtracted from that timeline, but it looked like there was nothing but more at each time point that you highlighted as another success, which they are. But as you say, sometimes you face that very difficult decision that, if we're going to do this really great project, we have to take something off the plate. And two, and so it's a combined question is how do you decide that? And number two, do you highlight it so that the organization actually sees that it is a dynamic organization and that you are adding and subtracting and is something the organization has to deal with and deal with professionally as well as it can?
Yeah, thank you for that question. I'll tackle the second question first. And I do think that we should highlight when we do these things, that we should highlight that we're adding and subtracting. I think that should be part of the very fabric of our organizations writ large. I don't think that is typically part of our organization. So I think that when we subtract things, that's when people get so emotional about it because we historically don't ever subtract anything. So I think if we normalized that adding and subtracting, if we normalize the process of assessing in some sort of regular cadence, then it would take some of the angst out of it when something is proposed to be sunsetted. So that's kind of the second question. On the first question, you're right. We do add, we add, we add. In some ways, I think you can add to a point and then you sort of fall off the Starling curve, right? So there are ways that we can be more efficient. There are ways that we can collect data more effectively. There are ways that we can do it less expensively. There are ways that we can have a greater impact. And so we can kind of add, because we're getting better as we're adding. But there does come a time for sure where, you fall off the Starling curve. You've added just one thing too many and then the quality starts to slip and then people don't trust your data or, what have you. So, I mean, I don't have an answer objectively about what that time is, but I do think that your second question is the answer to your first question. Like a cadence of looking objectively is what gets you out of the trouble of just adding and never, taking anything away.
Dr. Mogul.
Okay. Sorry. Thank you, Dr. That was a very, very inspiring talk. I'm going to rock the boat a little bit here. Please. Something that might be a little bit controversial. So I was totally taken up by your graph on tension and performance, especially on the side of polarization. You might anticipate where I'm going. But in today's day and age where we are all faced with a ton of social issues that affect us in general and affect our patients in general, what advice do you have for us as surgeons and leaders in general of how to navigate that complex dynamic, especially that we all have very strong feelings about where we need to lie, on what side of history, for example. And so it's a challenging dynamic to navigate today, especially that there's so much polarization. What advice would you give us, and leaders in particular, how to walk that tightrope?
Well, thank you for that question.
That's an easy one.
Yeah, that's an easy one. So I will start by saying I do not have a good answer to that question, but I will say a couple things. One is, we have to be authentic about like what is core right and wrong, and sometimes making the right decision requires us to take some incoming, right? But I mean, when I think about making those tough decisions, I think about what would it look like if my decision was on the front page of the New York Times? Like, what would my mother say? Like, what would my kids say if they knew the decision that I made? And so that if there are challenges, that very quickly makes it clear. Like, I want to be on the right side of history with whatever the thorny decision is that I made. The more lengthy answer, though, involves the fact that you were so correct that the misinformation and disinformation circulating now makes it very hard to have a decent conversation with many people about many things, in large part because in the past, I'll just say that I'm not going to pick any time frame, but there was a time where you could respectfully disagree, have diametrically opposed opinions, but at least you could agree that like the sky is blue and the grass is green. Like now, you can't even really get people to agree on that. And that makes it really difficult. And that's why I'm sort of hedging my bets, because I don't honestly know, because if I had an answer, I would tell you, I honestly don't know what you do about the epidemic of misinformation and disinformation, because that has moved us from tension, which is okay, disagreement, which is okay, arguing, which is kind of okay too, to like, we can't agree that people are like standing upright and breathing air, right? I mean, we can't even agree on that. So I think it's a new day and I have to like think about what my more cogent answer to your question would be. But I think to the extent possible, trying to find some common ground and starting from there. Like that's the best advice I have. Like where there may be some sliver of information that both sides agree on, and like starting from there and going outwards is probably the best advice. Thanks for that question.
Pellegrini. I'm going to be easier than that. First, I think Strauss will be very proud of the 75th lecture. I think the family should also be very proud. It's a wonderful lecture. I want to disagree with something that you said, and something that I have heard over and over, and I have tried to correct over time without success. You said surgeons are natural leaders, and I don't believe that's the case. I believe surgeons are put by society, by patients, and by hospitals in a position of authority within the operating room that allows surgeons to exercise leadership in all the ways that you said. Unfortunately, frequently, surgeons use the authority only, and they perhaps abuse or not understanding other people. So I think surgeons need to learn leadership. And I think that this idea that we continue to propagate surgeons are natural leaders strikes me as we're not doing ourselves any favor because we're not leaving any room for learning true leadership the way you're explaining today.
I think you make an excellent point, Dr. Pellegrini. I do not disagree with you. And I actually like the fact that you emphasize that we all can be more effective leaders. Like leaders are not born. We don't spring, fully formed out of the brow of Zeus, right? Like we can all be more effective leaders. We can all learn to be more effective leaders. So I appreciate you making that point, and I don't disagree with you at all. Thank you.
So, Dr. Turner, I want to give you the medal from this memorial lecture, Alfred A. Strauss Memorial Lecture that we have up above as well, with your name engraved on the back. So,
Thank you.
So I think we could not have done better than having Dr. Turner here as our 75th Alfred A. Strauss Lecture. And I just want to finish up with acknowledging the family. And so what I'd like is Dr. John Strauss, Carolyn, Leslie, Michael, Benjamin, Betty, John Friedlander, please stand up so we can recognize you. So I have a huge amount of gratitude today when it fills me up to come here and to see the morning that we had and to hear from faculty across the divisions that we have across an enormous breadth of areas of specialization. We had a roundtable yesterday that added to that. And what it reminds me of, and I shouldn't need to be reminded of it, but it reminds me on a day like this, the incredible people that are in this department, the incredible breadth of work that we do, the privilege that we have to do the work that we do that makes a difference for people, and the privilege that we have to work with each other, because we have a really incredible environment of people that lift us up and make us better, that make us smarter and challenge us. Part of leadership is learning how to grow and also know when to push back. And Dr. Pellegrini, your point is right. We are put in leadership positions, but not because we're natural leaders. And so that is a great correction of learning leadership so that we are better in all of those environments that we're in, including the most basic one of what we do every day in the operating room, in leading the team in the operating room. So my gratitude to the Strauss Friedlander family for your continued support of what's a really important day for us, and my gratitude to Dr. Turner, Dr. Kyle for both being here, and especially to our faculty, residents, fellows, and staff for all of what you do to make the work that we do important and the value of being a member of this department.